Ghaffar.
Good morning.
Good morning, and it's Patrick Jones, is that correct?
Yes.
It's nice to meet you, Patrick. How can I help you today?
Well, I'm a bit worried really because last night I woke up and I had severe chest pains, and originally I thought that it was just heartburn, but it came back again, and it was really painful, so I was just a bit worried really.
Sure, now you've said you're worried. What were you worried about?
Here the doctor picks up on an important cue immediately about the patient being worried about his chest pain.
I thought it might be a heart attack or something like that.
Was there any reason that you thought it was a heart attack?
Well, my brother had a heart attack some couple of years or so ago.
Right, okay, and that's why you thought it might
Yes.
be then. Okay, so what I'll do is, if it's okay, I'll ask you a few more questions about what's been going on. So you mentioned that this started last night. Do
Yes.
you remember roughly what time that was?
About 12 o'clock or so. That's when I first woke up with it.
Okay.
And it is important to elicit the timeline for the patient's chest pain, as this will help develop the management plan, which the doctor has done well here.
So I got up and at first I thought it was heartburn.
Okay.
So I got up and took some milk and relaxed for a bit, and after about 30 minutes it seemed to get better, so I went back to bed and went back to sleep.
Okay.
But then it came back again, and I woke up at about 2, and it was really quite severe then.
Okay. And when you woke up at 2 o'clock, how long did it last for? Can you remember?
About 30 minutes or so before it started to
Okay.
ease.
And when you had the chest pain, can you describe to me how it felt?
It was a really sharp pain in the middle of my chest.
Yes.
And it was like somebody was sitting on my chest. It was really difficult to breathe. And
Did you have any other symptoms like feeling sick with that?
yeah, I felt sick.
Yes.
But I wasn't actually physically sick.
Did you feel sweaty at all?
Yes, I did. Yeah.
Did you feel your heart race in your chest?
Absolutely, yes.
You did, okay. And did you feel dizzy?
No.
No? Okay. The pain, did you feel that the pain moved anywhere?
It moved to my left shoulder.
Did it go up into your jaw at all or anywhere else?
No.
No, okay.
It is good that the doctor started the consultation with open questions and has now started to ask more closed questions relevant to a cardiovascular history.
Have you had a cough at all recently?
No.
No? Not coughed any blood that you're aware of?
Oh, absolutely not. No.
No? Okay. Any pain you've experienced in the back of your leg?
No, those have been fine.
No? And the pain that you had last night, is that there now?
No, I feel okay now.
Okay. So you mentioned that at 12 o'clock you woke up, you had a little bit of pain, had some milk, you went back to sleep, then at 2 o'clock you had very bad chest pain, and that lasted for about half an hour, but you've not had any pain since that, is that correct?
No, that's right.
Okay.
Here the doctor provides a good summary of the patient's problem.
Have I missed anything that...
No, there's nothing else. It was just that, and it was that worried me really.
Of course, okay. We've got here that you suffer with a high blood pressure.
Yes.
Is that correct? And you're on one blood pressure tablet.
Yes, that's right.
Okay. Do you take any other tablets from over the counter?
No, last night I took some Gaviscon to try and get rid of this, and it did seem to help, but
yes. Are you allergic to anything?
No.
No. You've mentioned about your brother having a heart attack.
Yes.
How old was he when he had his heart attack?
48.
And is he okay now?
Yeah, as long as he takes things easy.
Okay. And is there any other family history of heart attacks or strokes that you're aware of?
My father died of a heart attack.
Okay. Do you know how old he was?
Oh, he'd be about 50, I think. Quite young.
Quite young as well. And anyone with strokes in the family?
No.
No.
The doctor excellently asks the patient about his family history in a targeted manner.
Now, in terms of you at home, who lives at home with you?
Oh, I live with my wife, but she's not too well really, because she's got arthritis, so I have to spend a lot of time caring for her.
So you're her carer?
Yes.
Okay. And do you work as well?
Yes, I do. I'm a tool cutter.
Tool cutter, okay. And you've not had any problems with chest pain at work?
No, it's quite unusual, really.
Okay. Do you smoke at all?
Yes, I do.
Okay. How many do you smoke?
It's about 20 a day, but I have cut it down. It used to be a lot more. It used to be 40.
Okay.
But I have cut it down. But
okay, so it's about 20 a day at the moment.
yes.
How long have you been smoking for?
Well, since I was a teenager, so it's 20, 30 years or so.
Okay, fine. Have you thought about cutting down or stopping?
Whenever you can, try to provide opportunistic health promotion advice that the doctor excellently carries out here.
I would like to. I've tried,
Yes.
and but failed.
In terms of alcohol, do you drink any alcohol in the week?
I do, but I leave it for the weekend, really. I have about 4 pints of a weekend.
Okay. Is that in total over the weekend, or is it every day?
Yeah, I'd say
In total.
in total.
And do you mind me asking how you got to the surgery today? Did you drive?
I drove here, yes.
You drive, and you drive?
Yes.
Yeah? Okay, so you mentioned earlier that you were worried about your heart, and we can definitely have a look at that for you.
Okay.
Was there anything else that you were worried about other than your heart?
No.
Just that, okay. And sometimes people come to the room thinking about specific tests that we would do. Had you thought about any specific tests or any specific way we would treat you today?
ICE is used by the doctor to good effect here, nicely grouping the questions to elicit the patient's concerns.
Well, not really. I just wanted to come along and kind of just mention what happened, just to see. I'm hoping that everything was okay and it was a one-off.
What I'd like to do now is examine you, if that's okay.
Yeah.
I'm going to check your blood pressure. I'm going
Okay.
to check your heart and your lungs.
Yes.
And I'd also like the nurse to do a heart trace for you. So we're just going to send you away just to get a heart trace done. It's just so I can see the rhythms of your heart and see how they are.
Oh, okay.
Would that be okay?
Yes, that's fine.
Okay.
It is always important to explain all the examinations that you are about to carry out on a patient. Be specific and obtain the patient's consent. As mentioned in a previous video, don't assume the examiner will be giving you the information. Continue to carry out the examination, and the examiner will stop you if an examination is not necessary.
Okay, so checking all the tests we've done today, they have all come back normal, which is good. So your heart trace is okay, your blood pressure is okay. However, you mentioned you were worried about your heart, and to be honest with you, I'm also worried about your heart as well. You mentioned about heart attacks as well before, and that is one of the things that I am worried about.
Don't forget to readdress the patient's ideas, concerns and expectations. The doctor has done this here and shows that she has been listening to the patient. The doctor uses the patient's own language to explain the possible diagnosis.
Oh.
I can see that's taken you back a little bit. Okay. I'm worried about your heart because sometimes when you have very severe pain like you've described, it can be a way that the heart's telling you it's not getting enough blood. Okay. And especially with your family history, with your brother and your father having heart attacks at quite young ages, I do think you'll need some more tests doing.
Oh.
What are you thinking now?
Here, the doctor picks up on the patient's nonverbal cues. The patient clearly seems anxious from his body language and tone of voice, and the doctor picks up on this and addresses these appropriately.
Just what those tests are and what they might show, really.
Okay. Well, firstly, the tests are done at the hospital. So I would like for you to go up to the hospital. And what they'll be doing is they'll be doing some blood tests to check some specific levels related to your heart.
I just don't like hospitals and...
Have you had any bad experiences before in the hospital?
No, I can't say that I have, really.
Yeah.
It's just the fact of going into them and you have to wait, and the longer that you wait, the more anxious you
Okay.
get.
It can be very anxious. It can be anxious coming to see us as well at the surgery sometime, and it can be very anxious going up to hospital. So I can understand where your worries come from. In terms of you waiting, I'm happy to give the hospital a call to say that you're coming through. So you won't be waiting in the emergency department. I'll be talking to the medical team, so they will be expecting you on the other end.
Oh, okay.
Is that any easier on you?
Picking up on the patient's fear of referral, the doctor reassures the patient to help make the process easier for him.
If it makes it a bit quicker, yes, that does make it easier, because I've got to be worried about my wife, obviously,
Sure.
because I'm looking after her, and if I'm away for too long, you know, it will make it easier.
Would there be anybody to come and help look after your wife if needs be? You mentioned your daughter.
Oh yes, I've got a daughter, but she doesn't live with us, obviously.
Okay.
But she can help out, and as she does when I'm at work anyway.
Okay. Would you be happy for me to send you up to the hospital if I made arrangements for you to go?
In the arrangements that you've described, yes. I suppose I'd rather get it sorted out rather than anything else.
Absolutely. I wouldn't want you to go away and something like this, a bit more major, happens. So we do need to make sure, we need to check and see what's happening with your heart.
Yeah.
Okay. I wouldn't really be happy for you to drive up to the hospital just in case you had another episode like this whilst you're driving. Would your daughter or somebody be able to come and take you up to hospital maybe?
The doctor excellently provides driving safety advice to the patient, advising him not to drive to hospital, and safely negotiated the arrangement to get the patient to hospital.
Yes.
Yeah?
Yes.
Okay.
It's
Now,
fine.
do you have any questions from anything that we've discussed so far?
No, not really.
If there are any other problems, please do come back and see me. But I would like for you to go straight up to the hospital now, and I'll get that letter done.
Right, today?
Today.
Okay.
Okay. Well,
So how did this doctor do? The doctor recognised that this was an acute referral, had a structured and focused history, and referred the patient appropriately into hospital. The only criticism I would have would be to organise a follow-up on discharge and discuss the outcome of the hospital admission. However, overall, the consultation was carried out well, and this would be a clear pass in all domains.
thank you very much, and I'll make those arrangements for you.
Thank you very much.
Thank you.